The Philippine Nurses Association of Nevada now brings you Philippine NARS, news and features about the Filipino-American nursing community and beyond. And now, here's your host, Doris Bauer.
Well, hello, Philippine NARS listeners and followers. Happy holidays. Thank you for joining us today. And as you know, Philippine NARS is brought to you by PNANV, or the Philippine Nurses Association of Nevada, in collaboration with PHLV Radio. So one of the goals of this podcast is to highlight the different organizations and healthcare workers that are involved in patient care. And so today we are going to talk about specialty pharmacies. What are they all about? And what are the services that they provide? So the Academy of Managed Care Pharmacy defines specialty pharmacies as the pharmacies that are distinct from traditional pharmacies in coordinating many aspects of patient care and disease management. They are designed to efficiently deliver medications with special handling, storage, and distribution requirements with the standards of processes that permit economies of scale. So specialty pharmacies are designed to improve the clinical and economic outcomes of patients with complex and chronic and rare conditions. So with close contact by the clinicians. So let's see, today we are going to actually talk to several people who are involved in the specialty pharmacy business. So today, that's why we involved actually Miss Lizelle Trinidad, who is actually here in Las Vegas.
Yes.
And she is an account manager of the pharmacy. And joining us today on Zoom is Mr. Robert Ojeda from California. Thank you for joining us, Robert. And Miss Sally Chia from
Hi.
You're here in Las Vegas, right, Sally?
I am, yes.
Okay, all right, very good. So I would like to first start with Mr. Robert Ojeda, who has 20 years experience in healthcare space, and is a managing partner of the pharmacy called 986 Pharmacy Group. And he is, or still the president, right, of K&B Pharmacy Associates. And he is a managing partner of Caris Enterprises. And I don't know, he's a Southern California native, and he resides there. So, Robert, can you tell us a little bit more about your experience?
Yes, and thank you, Doris. Thank you for everyone for having today's call. I want to start out by saying we've been in practice, pharmacy practice to say the least, for the past 20 years. We just celebrated last July our 20th anniversary in pharmacy practice. That premise of independent pharmacy space has ballooned to a number of almost 50 locations over the past years.
Wow.
And here in Clark County, we have 4 of those locations.
Okay.
4 locations that really encompass retail specialty, and long-term care. That has really been the premise of our business and model. For myself, I'm also, you listed a few things under there. They all complement one another. For myself, my main responsibility is the contracting arm that entails both pharmaceutical manufacturers, wholesale distribution, and contracts between our group of stores and the manufacturers and wholesalers of sorts. The other part of that is Caris Enterprise, which is our warehouse distribution side of it. We do carry certain medications in there to help streamline and literally cut costs of medication to allow us to get, number one, better pricing, and then access point and better efficiencies or increased efficiencies back to patient care. And then I bounce back and forth. My residence, yes, I'm in Southern California, but I'm just as much, almost, if not here more, in Clark County than I am in Southern California. I'm kind of bouncing back and forth. My daughter, who's 16 years old, still is in high school in Southern California. So definitely that's a priority for us as far as family goes.
Of course.
But I will say, sooner than later, I will be a resident here of Clark County as well. We love it out here.
It's more fun over here.
Yes, a lot of fun, Doris.
Yes, yes. Well, thank you for that, Robert. And I'd like to turn on to Miss Sally Chia over here. Sally, can you tell us a little bit about yourself? I know that you're a pharmacy manager for one of the locations here.
Yes. Hi, everyone. My name is Sally Chia, and thanks for having me on here. So I have been a pharmacist, practicing pharmacy for over a decade now. I was originally from Philadelphia. I graduated from the University of the Sciences in Philadelphia. It used to be called Philadelphia College of Pharmacy. It is one of the oldest one in the nation, actually.
Wow.
But yeah, so I've been practicing in Vegas for 14 years now, specializing mainly in like retail pharmacy and compounding.
Compounding. Okay, very good. Well, welcome to the program. And of course, last but not least is our friend over here, Miss Lizelle Trinidad. Lizelle, I know you are a respiratory therapist by background, right? And she does all kinds of other things.
Yes.
So can you tell us about yourself?
I didn't think I have to introduce myself, but okay.
Yes, you have to.
Hello, everyone. Again, I'm Lizelle Trinidad. So, so this is my other hat. I am a respiratory therapist by profession, and I'm also one of the account managers for 986 Pharmacy. So my job is to let the community know that we are here to serve them and help them with their medication needs.
Yes, very good. Thank you, Lizelle, for joining us. And FYI, for those of you who don't know, she is the editor-in-chief of the Philippine Times of Southern Nevada. So just
Yes.
throwing it out there. So, okay, well, thank you and welcome, everyone. So, and you can tag team on these questions, okay? So, do you, our first question is, do you comment or can you comment on the definition of specialty pharmacists by the Academy of Managed Care Pharmacists? Is that, does the definition suit what you guys are doing?
I think the definition has definitely evolved to a hybrid model of what is classified from, let's say, the Board of Pharmacy to a managed care system, an ASO or MSO, or even a PBM. They each have their own little unique definition of what a specialty pharmacy entails. I can say we're a melting pot of all of it. When you take a look or define what a specialty pharmacy does, it is not just your normal retail store that just receives a prescription and processes it and dispenses it. We take our time with each individual patient. If there is an instance where there are a chronic disease patient with multi diseases, chronic illnesses of sort, we'll take a step back and really assess all the different medications, assess the physicians, communicate out to the physicians what each of the medications they're taking, and then ultimately we try to get them off as many of those meds as possible, and really create an efficient medication therapy management for a patient, especially those taking in excess of 10 medications or more. So when you encompass that, it's not your normal pharmacy, to say the least. It's more of an assessment of what is truly needed from the patient's need. How do we create an efficient model to reduce the number of medications that they're taking? And then if there's prior authorizations, we communicate to the doctor of what is taking place with the current authorization of the medication. We'll even take it a step further to deliver the medications if needed. And fortunately, we have enough employees that speak numerous languages, I think a total of 9 languages the last time I checked, to assist and not to have like a Google Translate of sort, but actually have a person on the phone to communicate to those in need. So when you say specialty, it's kind of a melting pot for us that encompasses numerous facets of therapy and really encompassing around medication therapy management.
Medication therapy management, that is correct. So, yeah, that is a special, service actually that you guys provide. So, Ms. Sally, I'd like to punch to you this question. So, can you tell us about 986 Pharmacy, the history? I know there is a connotation to that 986, and I'm sure you'll tell us about it.
Sure. So 986, it's the normal body temperature, 98.6 degrees Fahrenheit.
Exactly.
We try to keep everyone under or within that range, which is normal body temperature. And then, so that's what 986 is about. We want to make sure that everyone's healthy, taking their medications, managing their medications properly. That's what pretty much 986, where that name came from. And then, Robert, if you have anything to add on to that.
I love that 986 actually. So, what's the history of 986 Pharmacy, Robert?
Yeah, so we have a handful of stores that are the precursor to 986, or what we call the franchise model of our store branding. I say that because initially we have 5, and we still do have 5 locations that are not titled 986, that were, like I mentioned, the precursor to 986. What we realized is that our projections 20 years ago, where this started, 986 started almost a little over 10 years ago.
Mm-hmm.
We realized was the pipeline of where we were going, this trend of our expansion required a consistent branding behind our messaging. So we went and looked at different ways to support the Filipino community, the Chinese community, the Vietnamese community, the Spanish community, and you go down this laundry list of all the different demographics and ethnicities that we deal with, and we reached out to a marketing firm. And to make it a long story short, it was recommended we do a 3-digit number that wasn't curtailed to one ethnicity over another. We wanted to keep it very simple, something that you would remember, and we also wanted to correlate the number to health. Hence 986 Pharmacy. This is my logo, if you can see that on my shirt. I don't know if
You can't, but it's brilliant actually. It's really cool. I love it.
So, okay, see if you can get that a little bit closer. Right?
Yeah, here it is for the audience, right here.
We did that purposely for the fact that, number one, 986 is your body temperature. 2, it's a 3-digit number, numerical number that's easy to remember. If you flip it backwards, it still says 986. You flip it forward, it still says 986.
Oh, I didn't think about that.
Another way to think about that. And then also, we wanted to make it feasible, not, like I said, to curtail just to one ethnicity over another. And hence, 986 is your body temperature. We wanted to keep that consistent, and the branding of 986 was born.
Yeah, so if you're reading backwards or upside down, it still says 986. That's awesome. That's awesome. Well, thank you for that. Thank you for that. So, what are the services that actually y'all provide for as a retail? No, not as a retail, but as a specialty pharmacy. I know you do retail. You still do retail pharmacy services, Sally? Or
let me take that out. Yeah, so here locally in Las Vegas, we have a retail side. We do long-term care. We also do a little bit of specialty, which is the compounding side of things. But that's pretty much what we offer here in Las Vegas. We offer more personalized services if you're comparing us to other pharmacies, and then we offer free delivery.
Okay. Do you have over-the-counter products as well? Do you carry those?
We do. We do carry over-the-counter products. At our Del Webb location, we carry gifts, we carry cards. We kind of try to customize it to our neighborhood. Most of the patients, when they come in, they'll see or ask or look for certain items, and we'll try to accommodate them and make sure we have it available.
Okay. Do you do any compounding here in Las Vegas? do you do any compounding?
Yeah, so we do non-sterile compounding, mainly hormone replacements, topical pain creams. Uh, we do suspensions for children, and we also do pet medications.
Okay, great. Robert, how about the other sites? I know you guys are here in Nevada, you're in California, Texas, and I'm not sure what other states you're in.
Yeah, so I'll start here in Nevada. First of all, our locations were able to support Clark County. If there is a patient in need in Clark County, and even in Pahrump, for that matter, in Nye County, we were able to serve. We have enough infrastructure in place to support getting medication out to those patients, including durable medical equipment. And we've taken that even a step further, not only being a specialty pharmacy, but on the retail side and long-term care, we have durable medical equipment. And then also we take it a step further, we're Lizelle. I mean,
Yeah, she was just telling me.
on some of the initiatives here, but I will say that I'm not too sure of how many pharmacies have brought on a respiratory therapist. And I say that because specifically to Clark County, we have a significant amount of patients that are in need of advice, expertise, even nebulizers, oxygen for that matter, anything dealing with any upper respiratory disorders. We are here to help those in need. So you ask what we're doing here. This is another step that we're taking for 986 Specialty Pharmacy to better serve the community when it comes to that aspect of it.
So I'm really glad. I'm really glad you had put on a respiratory therapist on board. I actually have worked with home infusion pharmacies, including part of it are the specialty medications that y'all probably don't provide, but it's very rare that they do have a respiratory therapist to handle the DME side. So can you tell us about what your plans are for here in this area?
Well, the plan is really me being a licensed respiratory therapist. It's like an additional tool that we offer to the community. It sets us apart from the other pharmacies because there will be questions where only a therapist can answer versus just going to your local pharmacy. Like right now, we have a lot of patients that are on the CPAP and BiPAP therapy, and they have concerns wherein their mask is not fitting right, or they're having a hard time sleeping with the CPAP machine. So me being an RT and being available for them, I'm able to really just help them go through it and be more compliant, so they get better and have a better report with their physician.
That's good. That's really good. I think this is the first specialty pharmacy that I know of here in this community that actually does have a respiratory therapist. Most of them are just the DME companies, which are not basically associated with a specialty pharmacy, correct?
Yes.
Yeah.
I will say we're also taking it a step further, where this is a call out to the community for vaccinations. One of the initiatives that we did in Southern California is we were the largest independent pharmacy, vaccinating pharmacy in LA County. In those initiatives that we did over COVID are now overlapping into Clark County with this infrastructure in place. So I will say that the call out to the community would be to reach out to us. We are going to be coordinating outreach events. We are going to be not only at the pharmacy level, but coordinating senior living centers, assisted living facilities, and so forth, to better serve the community and make it as convenient as possible to those in need.
Yeah, that's actually, thanks for bringing that up. A couple of the items I was going to ask you later, but let's look into the assisted living facilities and boarding care homes. Do you do that now here currently, or are you planning to do it, or where in your organization, what states are you already doing this?
We've been doing a significant of assisted living, skilled nursing, and hospice in Southern California.
Okay.
We've been doing it for over a little over 11 years on the assisted living side of it. I will say that 2 years ago, about 2 years ago, we did merge our skilled nursing side away from our operations. And we mainly focused on, and we currently still focus on assisted living, boarding care, hospice business. I would say it became almost cumbersome because we were running so many shifts, and it was open 24 hours, 365, that we partnered with another pharmacy to handle the skilled nursing side. So that allowed us to focus even more so on the boarding care and assisted living side, but very familiar, very well versed. In fact, at one point, prior to us merging off the skilled side of the business, we were the third largest independent long-term care pharmacy in California.
Oh, very good.
So definitely we've come with a lot of expertise behind it. In fact, the manager of that location, when it was at its peak, is our partner and colleague out here in Clark County, is Dr. Danny Tai. And he runs our operations alongside Sally Chia here in Nevada. So comes with a wealth of experience, and we are now moving forward those same initiatives and best practices from Southern California out to Clark County, Nevada, to increase the level of support and service, just as we've done over the past decade in Southern California.
That's good. Buckle up, Sally. You got more things coming your way.
I know.
I didn't mention that to her.
Keeping busy, you know.
Surprise! but anyway, no, seriously, it's really good. It's that goal is really good. But let's talk about medication therapy management, Sally. How does your staff do that? I know there's some people who come in and they have like a list of 10 million medications. How do you guys handle that?
Yeah, so we offer this medication therapy management by we can set up times with patients where they bring in like a brown bag. We can have a brown bag event. They'll bring in their medications. We'll sit down with them, or even they can set an appointment up with us, and we go through every medication that they're on. Not only prescriptions, but also anything that they're taking over the counter, vitamins, supplements. Those can cause some side effects or adverse effects. So we'll go through that with the patient, make sure that there are no interactions, or if there is, we would reach out to the providers, let the patient know, and also try to reduce that medication. I know Robert touched on that subject earlier. When a patient is on medication, they're going to multiple providers.
Right.
Not all the providers know what the patient is on.
Prescribing.
Yeah,
right.
and, yeah, exactly. And sometimes patients forget to tell their specialty doctors what they're currently on, so then they may have duplicate therapies, and that can be dangerous. So we want to go through that with the patient, and then we'll inform the patient and the providers that they need to be off of something. So that's how we can really help manage the patient and just make their lives better. Get them on less medication so they're not having any side effects or issues.
Drug reaction or whatnot, or repetitive drugs that they're taking, right?
And then we also can offer bubble packages to help them manage their medications properly, making sure that they're taking their meds on time. So that's another service we offer.
That's good. Well, that's good. That's really good to know. Not a lot of IV pharmacists or specialty pharmacists offer that, actually. So let's talk about, now your website mentioned something about 340B clinics. Can someone explain to the audience what 340B means? Robert or Sally?
Robert?
Or Lizelle?
So 340B is really the law. It's one of the laws that was passed on a federal level to assist clinics that are titled nonprofit, but then allow access to medications from pharmaceutical manufacturers at a very steep discounted rate. These clinics are called or titled federally qualified healthcare centers, and hospitals with a similar business model are called DSH hospitals. These nonprofit segments, whether it's a DSH hospital or an FQHC, now qualify for medications under the, I don't recall what HRSA stands for, but it's HRSA. HRSA is the governing body.
HRSA, yes.
It's Health Resources and Services Administration.
Yes.
Thank you, Sally.
Thank you, Sally. So I've used the acronym so much it gets lost in translation. So I will say that this type of model has allowed us to become the contracted pharmacy with the FQHCs or DSH hospitals to serve those patients. Those patients are underserved patients that qualify, that are below the Medicaid threshold of the poverty line. I think it's, I forgot the exact percentage, but it's below the poverty line. So definitely those patients that are in much need of medications. The disease states are across the board. We find us more tenured with individuals that are mental health issues of chronic disorders of sorts, as diabetic patients, CKD patients, chronic kidney disease patients, patients that are really need a hands-on approach that are under the poverty line fits this criteria. So this is where we come into play to assist those clinics. And because we have now 4 physical footprints here in pharmacy, one of them being a long-term care, this allows us this infrastructure I had mentioned to deliver throughout Clark County. So when I focus on those 340B clinics, those patients are underserved. They may lack transportation. They may not have family. They may speak English as a second language. All these barriers now take major factors of obtaining medication and getting the right therapy for their needs. So this is where we go in and we literally have a more hands-on approach to better support and serve those patients that are in that criteria.
Yes, and yeah, we do have a lot of underserved. Well, there is a huge underserved population, not only here, but elsewhere. So that seems to be the biggest challenge of healthcare, actually.
And I would say between here and Nye County, between Clark and Nye County.
Yes. The rural areas, right? Mostly. Yeah. The rural areas. You run into a whole bunch of issues. So I'm so glad. How does it affect you, Lizelle, as an account manager in getting all those? Is that difficult for having somebody come and sign up with you guys to partner up with you, or?
Not really. It's more like because the way I've always built my relationships throughout the community, it doesn't have to be that we'll talk business, but it's always like, I'll just come in, say hi, have a conversation, and then, we find out if there's a need that we can fulfill, and then then we bring up our services, and then, if it matches, then, we make a connection.
Very good. Very good. Yeah. So, well, yeah, that is kind of good to know. So what kind of specialty medications or chronic diseases are you currently serving right now?
I would say it's really open to what are the needs. I will say that we're always looking at assessing what the needs are of disease states. I was in recent conversations with a large practitioner group in Southern California in regards to nephrology for patients with renal failure. And I will say that is extended out to us out here in Clark County. So think that if you have anyone in that criteria or disease state of chronic kidney disease, we are definitely hands-on approach when it comes to those patients, especially patients that are on binders and numerous medications that are in excess of even 15 medications. Now it becomes a more complex level of therapy when treating them. So I'm not going to isolate it to one disease state over another. That is just one example. I would say that when we look at a patient, we really just narrow down and hone in on what are the needs to get them
What are the needs? Right.
a healthier state. I mean, we could go across the board, anything from hypertension to CHF to any cardiac disease or neurological disorder or disease, and all the way down to patients that are nephrology patients. Another aspect that I don't think we've touched on yet is we work very closely with the Department of Labor for those patients that were government workers, employees of the government that have illnesses of sort. We specialize in that too. So it's not just your normal specialty store or retail store. If those patients are in need from the Department of Labor, we're well versed in what those include as well.
Good, good. That is really good information. So, thank you for that. I don't think a lot of people know about that. So, like many other pharmacists, and you mentioned earlier, Robert, that you also administer vaccinations. So, in your site, Sally, or any one of you guys, you're administering COVID and flu shots, right? And what other ones?
So we administer COVID vaccines, flu vaccines, RSV, shingles, Tdap, which are the boosters for Tdap. Those are our most common vaccinations. Pneumonia we can also vaccinate, but those are the most common.
Okay, so shingles, flu, COVID, pneumonia, RSV. Yeah, we've talked about RSV the last time, but actually, I want you to say this to the public: is it's safe to take the flu shot and the COVID shot at the same time?
It definitely is. So CDC's recommendation, they say you can take it at the same time. There's no problem with that at all. And it's listed on the CDC's website.
CDC website, that's correct. So how do you get the patients out there? They come to you, or do you disseminate information that you are providing this service as well?
Yeah, so we have patients coming into our retail store for the vaccinations. We also go out and promote, especially to the group homes, the assisted living. We'll set up a time to provide those vaccines to their residents, especially since they, can't really get out of or they can't bring a whole, a large group of people on a bus to a pharmacy.
Yes.
So we would go out there to set up a clinic, and we'll vaccinate patients there.
Okay, very good. Very good, and that's really kind of important. So, the keeping up to date with the vaccinations is important. I mean, that's true. So, is there anything else that we didn't cover? Any part of your services that we didn't cover?
I want to say, in terms of the vaccination, we also have this initiative that we're building right now, because we are partnering with associations and organizations like the Philippine Nurses Association, where we can, because we're very mobile as a pharmacy, so Sally can go to the sites and we can do a pop-up clinic for the vaccination. So we just coordinate them with whoever is the leadership of the organization, any kind of event. So those are some of the things that we are initiating for this coming year, is to be able to reach as many people as we can for the services that they need.
Yes. Let's do a brown bag event.
Nice.
What do you
Yeah,
say?
brown
Let's
bag
do
event.
it.
That's great.
Yeah, let's do it.
Yep.
Absolutely. And we'll have food.
That's
Asians. That's how you can bring them in.
Food always brings people
we'll feed
together.
you. Come in.
I think I have a pharmacist that I used to work with.
I wasn't going to go until I heard food. So.
Yes.
Oh yeah, of course.
We'll have food trucks or something.
Okay.
Yes.
All right. Well, so what is your message to the community in regards to specialty pharmacies and the flu and the COVID vaccinations? Let's start with you, Lizelle.
Well,
What's our message? Well, we are here. We are your neighborhood pharmacy. And if there's anything that we can help you with, please do not hesitate to reach out to us. You can easily Google us. Just type in 986 Pharmacy. We're the only one that has the numerical number.
That miracle number. I love that, by the way. And what about you, Sally? What's your message to the community?
Yeah. So, with vaccinations, I feel like it's one of the most important and effective ways to protect yourself, your loved ones, and and the community from that serious illness. So, like, these viruses can lead to severe complications, especially in those that are older, the elderly, anyone who has like underlying health conditions, and also to young children. So, we need to stay up to date with these vaccinations. And it's a simple, safe, and, powerful way to contribute to our the public health.
The public health. That's correct. That's very good. So, with regards to your staff, are you only staffed with pharmacists and farm techs, or now an RT? I guess is there any other type of staff that you need?
Yeah, we have a large group of us, not only just the pharmacists, the technicians, we have account manager representatives, we have our delivery drivers, we take in pharmacy students, pharmacy technician students.
Nice.
Robert, what else do we have?
We have a whole portfolio, including clerks that can take information down. And that was one of the things I was going to chime in on, saying on how we complement what you had stated in regards to vaccination. But if anyone listening out there has questions about their medication, if anyone has questions about taking certain medication, please use us as a resource. This is what we're here for. We're here for ourselves, for our families, and our extended families. And I consider anyone that walks through our doors as our extended family. We treat everyone like they're our aunt, our uncle, our brother, sister walking through the door that is in need. And that's the important message, and I would say my takeaway from this conversation. We're here to help out the community, and we want to make everyone as healthy as possible.
Very good, very good. Well, so your current locations right now are in California, Nevada, and Texas, and where else?
That would be it.
That would be it right now. And that's over 50? Wow, that's awesome. Over 50 locations, right?
Almost. We're almost there.
Almost there.
Okay, almost there. Okay. Well, so if to the public, if you want to go to the pharmacy, it is 986 Pharmacy, and they have different locations here in
The Valley.
the Valley.
And also in California.
And also in California. Go to their website, 986 Pharmacy, and you can they can actually tell you where the locations are that are kind of close to you. So anything else you want to add to that?
That's it.
That's it? Okay. Well, that's
Thank you
good.
so much for having
Thank
us.
you.
Of course. Thank you so
Especially on a
much.
Saturday.
Yeah, Mr. Robert Ojeda and Sally, and of course Lizelle for joining us today. And we appreciate your time and the information that you have given us. And to our Filipinos audience, we leave you with this. A specialty pharmacy like 986 Pharmacy provides medications used to treat rare and complex health problems. Many times, these medications aren't used by many people, so a local pharmacy wouldn't keep them in stock. So, unlike local pharmacies, specialty pharmacies like 986 are the ones that tend to be more involved in your health care, and they can help you with your medications correctly. So they can communicate with your healthcare team and your health caregiver as well. And with regards to vaccinations, I echo Sally and Robert here by saying that the CDC recommended the updated COVID-19 vaccines, and they have also the flu vaccines this winter. It is safe to receive COVID-19 and flu vaccines at the same visits. So if you're interested in looking more about that information, you can go to the CDC website and they will tell you all about it. So again, thank you so much for joining us today. Thank you to the audience as well, and thank you for giving us the privilege of your time. Please stay safe when celebrating the holidays. This is Doris Bauer, your Philippine NARS host, signing off for now.
The Philippine Nurses Association of Nevada has just brought you Philippine NARS, news and features about the Filipino American nursing community and beyond.